in the blink of an eye. Your life can change forever. The things you take for granted, tying your shoes, picking up keys, kicking a ball, getting upstairs, talking, walking, drinking, become an impossible task. Strokes can affect anyone, anywhere, anyhow. Get help fast. Science can change your prognosis, your future, and your life.
Globally, roughly 1 in 4 people will die when they suffer a stroke. World health experts declared strokes a catastrophic disease in South Africa. It is estimated that on a daily basis, about 440 South Africans have a stroke. Of these, about 70 die, and about 140 are left with a life-changing disability. So someone suffers a stroke every 6 minutes. Stroke is the leading natural cause of disability and the 4th most common cause of death. Twice as many people die from strokes than from heart attacks. Stroke affects anyone, women, men, young, the old, thin, obese, rich, or poor. It knows no boundaries and has many faces. It's important, therefore, that we all know everything about stroke, what it is, how it occurs, how to prevent it, and what to do when you suspect that someone is having a stroke. This is the focus of our show today. With the help of our expert guests, we'll bring you all you need to know about stroke. So sit back, relax, and learn from this exciting show ahead. You can be part of the show by calling us with your questions or views on Johannesburg 714-6843, 6847, or 6857. Or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. I'm Dr. Sidlo Mutaung, and this is Health Talk.
A stroke occurs when there is an interruption in the blood supply to the brain. When a stroke occurs, some brains are temporarily starved of oxygen, causing them to swell and stop working properly. This is why the effects of stroke are worse at the beginning. After a few days, when the swelling starts to go down, some cells recover, but others may not. Even then, other parts of the brain can be encouraged to take over. Ischemic stroke. This happens when a clot blocks an artery that carries blood to the brain. It may be caused by a blood clot, which has formed in the main artery to the brain, a blockage caused by a blood clot, air bubble, or fatty lump forms in a blood vessel somewhere in the body and is carried in the bloodstream to the brain. A blockage in the tiny blood vessels in the brain. Hemorrhagic stroke. This happens when there is a rupture of a blood vessel in the brain. It may be caused by a blood vessel which bursts inside the brain, a blood vessel which bursts on the surface of the brain and bleeds into the area between the brain and the skull. It is important to understand that no two people are affected by stroke in the same way. Some people have only mild effects which improve in a short time. Others may suffer more serious and long-term effects. The effect of a stroke on a person depends on which part of the brain has been affected and how much damage has been caused.
Okay, so what exactly does it mean then to have a stroke? What causes this dreadful condition? Well, we're going to understand a little more about stroke from our special guests. First up in our Johannesburg studio, we have Hayley Novel. Hayley is an occupational therapist from Rehab Matters here in Johannesburg. Welcome to Health Talk.
Thank you, Dr. Stella. It's great to be here.
In our Cape Town studio, we have a stroke expert, Professor Alan Breyer. Alan is a neurologist and based in Cape Town at the Groote Schuur Hospital. Is that correct?
That's correct. Thank you.
Welcome to Health Talk.
Thank you.
Perhaps let's stay with you, Professor Bright. You know, we just showed a clip here about, how a stroke occurs and all of that. Perhaps just in simple terms, what is a stroke?
Well, a stroke is often called a brain attack, and
Right.
a brain attack does to the brain what a heart attack does to the heart. And as you've heard from the video clip beforehand, it really amounts to an interruption to the blood supply to the brain. Either a vessel supplying part of the brain gets blocked, usually by a blood clot, or alternatively, a blood vessel bursts and the blood floods into the brain, and therefore it deprives the brain cells of the essential oxygen and nutrients that it's required.
So essentially, because we hear there's two types of strokes, what you've just described now is essentially those two types of stroke. Is that correct?
Correct. The first kind is the so-called ischemic stroke. That's caused by a blockage of a particular cerebral blood vessel or brain blood vessel, and that is by far the most common type of stroke. Accounts for about approximately 80% of all strokes. The hemorrhagic stroke counts for about between 15 and 20% of strokes across the board.
Mm-hmm. Now, we're going to come back to, the causes, what causes strokes, because, clearly we need to know what leads to this blockage and what leads to these vessels bursting in the first place. But just in terms of, epidemiology now, do we have exact figures, or do we know really how common this condition is in South Africa?
We have an idea.
Right.
First of all, worldwide, 1 in 6 people will suffer a stroke in their lifetime.
Right.
So I doubt that there are many listeners that have not known or heard about a person that's had a stroke.
Right.
In South Africa, we have to deal with inadequate data, but using the data that we do have, I think the figures that you've given are more or less accurate.
Right.
So anything between 360 to 400 patients a day in South Africa, people a day in South Africa will have a stroke.
Right.
So it's a fairly common condition.
Right.
And not only do you run the risk of dying from the stroke, but a substantial portion of people may be disabled by the consequences of the stroke.
Well, talk about dying. Perhaps let's just focus on the effects of a stroke now in terms of symptoms. What are the typical symptoms of a stroke, for instance?
Well, the typical symptoms usually develop very suddenly, and that's why I think it's called stroke, because it strikes one out of the blue and very quickly.
Yeah.
So the common symptoms would be sudden onset of weakness, particularly on one side of the body. There may be sudden onset of numbness or loss of sensation on one side of the body, sudden onset of loss of speech, or even difficulty in understanding speech or difficulty in reading, sudden onset of walking difficulty or incoordination or poor gait, a sudden onset of a very severe headache that a person has never experienced before, or a sudden onset of a loss of vision in either one or both eyes, or sometimes sudden onset of double vision. All of those may be symptoms of stroke.
Okay. I'm going to invite a comment from our guest here in Joburg, but before that, I know that we've spoken generally about two types of stroke, but then we hear about this concept of a TIA. Can you just briefly take us through what a TIA is and what it means?
Yes. A TIA is very similar to a stroke, only milder.
Yeah.
A TIA is often called a warning stroke or a mini stroke because the symptoms are very similar to those that I've described, but they last for a much shorter period of time, typically between 10 and 15 minutes. Yeah. But these are often warning signs that that particular person who has experienced a TIA is at risk for another more significant or more severe stroke. And that risk is particularly high in the first month of that stroke. About 12% of patients who've had a TIA may go on to have another stroke within the first month, and half that risk occurs within the first 2 days of the TIA. So it's a warning symptom which people should not ignore, even though the symptoms may be relatively mild and disappear within a few minutes. But they should seek medical attention in order to detect any potential causes that may lead them to have a subsequent stroke in the future.
Okay. And for the sake of our viewers, perhaps that TIA stands for transient ischemic attack.
So ischemic attack means the brain is deprived of its blood supply, and transient means that the symptoms are transient.
All right.
So it's like a warning sign.
Okay, all right. Haley, we spoke a little earlier about risks. You know, I mean, the Prof just mentioned, you know, TIA being an important risk factor. But let's just talk generally around risk factors for a stroke.
I think you've got to look at your lifestyle. I think we know that we live in a rat race. Whatever city you live in, there's stress. We don't look after our health the way we should. People don't exercise because they've just got to work, earn a living. And the risk is not looking after yourself, not managing your own medical care. If you've got underlying conditions, please make sure that you see your doctor regularly. Exercise if you can. I think that's the most important, ensuring that you look at your lifestyle and there's a balance. Sleep. People think that they can, you know, manage without sleeping. Looking at your family history, very important to know. If there's a family history of stroke, know that you've got to look after yourself.
Obviously, you function at, you know, on the other side of the scale,
Yes,
essentially,
we
where
see the
you
people
rehabilitate
afterwards.
people. But based on your experience, you know, in dealing with, you know, people who've suffered strokes, what sort of causes or risk factors do you pick up as being responsible?
Most of them are health reasons, high blood pressure, stress at work, working long hours. Not if they're diabetic or they have a history of epilepsy, not looking after themselves. And they say, yes, but I'll get there, I'll manage it eventually, but they just don't do it. And then all of a sudden, it comes out of the blue. So blood pressure, cholesterol, managing your lifestyle, really important.
Okay. Let's just get back to Prof. Brian, Cape Town. Prof, we mentioned, I mean, Haley here mentioned some of the risks, you know, and she mentions obviously the issue of underlying conditions. What sort of underlying conditions are major risk factors for strokes?
The single most major risk factor is high blood pressure. And this is an important one because often it's undetected or the person is not aware of it until an event happens. So if there's a family history of high blood pressure, it's very important that one does check one's blood pressure and that it is managed appropriately, because that does put one at significantly increased risk for stroke. There are, of course, cardiac conditions, heart conditions that may predispose one to stroke. If the condition allows clots to form within the left-sided chambers of the heart. So people that have irregular rhythms, typically what's called atrial fibrillation, where the heartbeat is not regular, that may predispose one to having a stroke. Diabetes that's not well managed is also another risk. And of course, the people with very high lipid levels or hypercholesterolemia should also consider looking at the other risk factors and may need appropriate treatment for their raised cholesterol. But
it's important you mentioned
major. Sorry,
carry on.
In addition to those major medical conditions, I think it's also just having sort of taking note of an additional sort of lifestyle factor. Smoking, the effects of smoking, alcohol in excess, alcohol binging, and the illicit substance use are also lifestyle modifications that would help to lower one's risk of stroke and are not to be sort of underestimated.
Is obesity a risk factor for stroke?
A lesser risk factor, but yes, inactivity, lack of exercise, and obesity, the metabolic syndrome, as it's sometimes called, does put one at increased risk. But by far higher risk factors would be things like medical conditions like hypertension, high blood pressure in other words, atrial fibrillation, poorly controlled diabetes, high cholesterol levels, and of course the use of smoking, alcohol, illicit substances.
Okay. We've known strokes to be a condition that affects, you know, older people, but now we hear cases of children actually suffering from strokes. Your comment on that?
Yes, stroke can occur at any particular age. Now, when it occurs in the older person, which is by far the most common age group to suffer from a stroke after the age of 50 in this country, then the usual suspects, the usual causes are, you know, conditions such as atherosclerosis. This is the condition where you get fatty deposits within the vessel wall, which allows the clots to form in the vessel, which can then either block off a major blood vessel going to the brain, or the clot can dislodge and then travel further and block off a smaller vessel in the brain. You can also get damage to the small blood vessels that supply the deeper parts of the brain, and that's often caused by conditions such as, again, high blood pressure and diabetes, and of course the cardiac causes, any condition that allows clots to form in the heart. Those would be the common conditions that occur in the older individual.
All right.
Once you start looking at younger individuals or any individuals, then the causes of stroke widen considerably. So any condition that causes inflammation of the blood vessels, of the arteries, be they infective causes or immune causes, can also cause a stroke. Now, younger persons may, through very minor trauma, develop a little tear in the inner lining of a stroke, and that can allow a blood clot to form, and that blood clot can dislodge and land up blocking a smaller vessel in the brain.
Yeah.
So that would be another cause in a younger person.
Yeah, but fortunately,
course, if one
we don't see quite a lot of these strokes in younger children. Isn't that the case?
Fortunately, yes.
Yeah, all right.
Stroke in younger people is unusual.
Okay,
but
all right.
Certainly in
Okay, sorry to interrupt you, but we just need to go for a quick commercial break. Please stay with us because after the break, we get a first-hand account of what it is like living with a stroke. Don't go anywhere.
Health Talk, your show on health practice.
The people being empowered with knowledge so that they can change their behavior and reduce their risk of being sick.
How serious is stress at work?
If we don't address workplace stress, that negative stress, then it can lead to burnout and it can lead to depression.
How does absentees affect companies?
The one that's really problematic for employers is the one that is unscheduled.
How can companies organize their wellness program?
Health promotion mustn't just be a one-size-fits-all type of approach. It must be customized based on understanding of the unique needs of that particular organization.
For health tips that will help you to adopt healthy living with Dr. Sillo Mutawung on Health Talk every Saturday.
I will remember that day forever. It changed my life. I was at work. I was about to present. And then I thought, let me quickly go to the loo and I'll come back. But when I got to the loo, I suddenly felt dizzy. And I'm not someone who suffers from dizzy spells. And then I got out, and then there was a colleague around the basins. And I asked her to please help me get to a chair. When the ambulance people came, one of them said, it's a stroke.
Figures show that stroke is the fourth natural killer in South Africa. Living with a stroke is life-changing for survivors and those around them. After suffering immobility on the left side of her body, Mpomagale spent almost 4 months at Life New Kensington Clinic in Johannesburg. My life at home, my life at work was affected because I have been booked off for the whole year. I'll only go back to work in January. And in the process, I couldn't walk. Do you know how difficult it is to start to learn to walk when it's hard? It's hard. You learn to walk, you learn to wash yourself, you have to learn to dress yourself. Those are things I couldn't do. The impact on my family. They felt it very hard because I'm the breadwinner at home. My husband was retrenched. I don't even remember when. Although patients may not fully recover from a stroke, they can enormously benefit from therapy. Anna Bezos, a dedicated therapist from Life New Kensington Clinic, treats and rehabilitates survivors.
Patience, perseverance, it's not a quick fix. It requires involvement of the whole family, the whole medical team, and it requires the person who's had the stroke to understand the processes that they're involved in and that they are part of. For the majority of patients, there will be significant improvement, but it might take several weeks, it might take several months.
The effects of a stroke may be life-changing and challenging, but a stroke can be prevented. Looking after your health is important. Managing high blood pressure, also known as hypertension, reduces the risk of a stroke. High blood pressure increases the stroke risk by 4 to 6 times. Test for hypertension regularly, eat healthy, and exercise daily.
Exercise daily indeed, that's what we always say. Anyway, strokes are particularly tragic as they often strike the victim down in their productive years of life, sometimes removing breadwinners from families. Now, we're going to hear more about what it is like living with a stroke. But before we do that, let me introduce our guests first. We have in our Johannesburg studio Sandra Columbus. Sandra is a coordinator for Stroke Aid Society. Sorry, I misspelled your Colombic. Is that correct?
Colombic, that's correct.
My apologies. Colombic. Okay. And welcome to Health Talk, by the way.
Thank you, and thank you for having us and inviting us. Thank you.
All right. And then next to her is Neville Harvey. Neville is a stroke survivor, also a member of the Stroke Aid Society. Welcome to Health Talk, Neville.
Thank you, Dr. Seller.
All right.
Nice to be
And
here.
we still have, of course, Prof. Alan Breyer, who's a neurologist based in our Cape Town studio. But before we start our discussion, I believe we have a caller on the line, Arthur from Randfontein. Arthur, welcome to Health Talk.
Thank you very much.
Your comment or question, please.
I joined your program a bit late, but I have concerns.
Yeah.
I have this, okay, first let me say I'm diabetic, but I'm not on insulin. I'm on, metformin.
Yes.
Sometimes, I wake up in the middle of the night having this, my left side of the body, including my face, feeling a bit numpish, and I'll have, my face feeling like swollen.
Yeah.
I do regular exercises, and sometimes when I wake up in the morning as well, I would, feel like my heart is feeling fast, and I'm afraid, and like I'm getting heart attack or something like that.
Yeah. Have you consulted a doctor about this problem?
Yes, I've done that, and the doctor keeps saying to me that it's stress, and he'll give me this, sleeping pills that
right.
would relax me and things like that.
Okay.
But I'm seriously concerned because sometimes I feel very terrible in the middle of the night, and I have to wake up and do some exercises, because I do exercises regularly most of the time.
Okay, let's.
I would find out whether am I, a candidate for this stroke or what.
Okay, thanks, Arthur, for your question. Let's try and get some help from Professor Alan Breyer. Professor, I hope you heard the question.
Yes, I did indeed. Thank you.
Yeah, I know that obviously it's difficult to diagnose people over the air and that sort of thing. But generally, what advice could you give? Yeah, and what are your thoughts?
Well, the thoughts are firstly the underlying condition which does put one at an increased risk, the diabetes.
Right.
The best way to deal is to try and get optimal control of the diabetes so that one's sugars are well controlled, and one's doctor should be able to ensure that whatever treatment that you're getting, that your diabetes is reasonably well controlled.
Okay.
And then secondly, to deal with the symptoms at night, one needs a very clear clarification of what the symptoms are. But if they do entail an actual weakness of a face and an arm, or numbness on the face and the arm, then that should be looked at more seriously. To consider that a transient ischemic attack could be a possible cause.
Right.
One can't say for certain on the air, but that should be looked for more carefully to make sure that there are no causes that can be treated that have given rise to these symptoms.
So who should this person consult then?
Ideally, a neurologist or a physician with some expertise in stroke management, so that they can look see if there's any blockages in the blood vessels going to the brain, to see if the heart is beating regularly and the person isn't having arrhythmias, and to make sure that some of the very basic things, that the blood pressure is controlled, that the lipids are controlled, all those things need to be looked at.
All right, thank you very much. Now, maybe at this point, let me invite our guest, Neville. we introduced you as a stroke survivor from Stroke Aid Society. We'll hear more about what Stroke Aid Society is and what it does. But do you mind just telling us what actually happened to you?
Well, 7 years ago, I experienced my stroke. But before that, I did have a TIA, which was a momentarily blinding in my right eye.
Right.
And that lasted about 5 seconds, and then it disappeared. So I discounted it. But unfortunately, that was the trigger, and that was the warning sign, and 3 months later, I had the stroke. The stroke left me, it was a right side hemisphere, which left my left side paralyzed. I spent 4 months in rehab, undergoing rehabilitation after a series of operations.
Yeah. How did that stroke change your life, or how did it impact your life at the time?
Well, I was a very active person. I was a mechanical engineer, and I always was very active in everything that I did. And unfortunately, with a stroke, that put paid to a lot of stuff. So it was a life-changing situation for me.
And your family, how did your family react to it?
One of the things that we always do, and that's what happens with stroke survivors, that people tend to concentrate more on the stroke survivor than on the stroke survivor's family. They are the ones that are also living with a stroke, not only the stroke survivor.
Right.
And it's very important that those people are taken in and also given the necessary upliftment and support that is necessary for a stroke survivor.
Maybe at this point, let's hear from Sandra Columbik.
Yes, Doctor.
Tell us a bit about what you do at Stroke Aid Society, because he mentioned now that it's important to not just focus on the stroke survivor, but the family as well. What do you guys do?
Well, I can't stress enough how important it is to have a stroke support group.
Right.
Because as Neville mentioned, it's not only for the stroke survivor, it's for the families. And not only also for the families, but for the carers. The carers that look after the stroke survivor.
Typically, what do families go through? How do they react to someone in the family having had a stroke?
Well, I sit at the office and I receive phone calls, through the media, through the internet, and people say to me, family members had a stroke, and they sound very panicky. Where do we go? Where do we take them?
Right.
And we've recently heard now that there are hospitals, especially in the rural areas, they're starting to have stroke units there. But as far as the Stroke Aid Society goes, what we do is, in 1984, they felt there was a need by the speech and the hearing department at the University of the Witwatersrand. It was important to have a support group for stroke survivors, because people were panicky all the time.
And you're making an impact.
And they're making an impact. And they came out of their rehabs or their step-down facility, and they felt this was necessary. So what we do at the Stroke Aid Society, we interact with the stroke members. We've got a full team of therapists. We have occupational therapists.
Right. We're going to learn more about what occupational therapists do, but for now, we're going to go for a short commercial break. Now, how do we prevent strokes? Then and more after the break. Please stay with us.
And I'm Prabhakshini Chetty Miller, SAB Miller, Anheuser-Busch InBev. It's something that I need to learn to say more often.
Will together produce around a third of the world's beer.
It is a mouthful.
Have you ever considered skin bleaching? Nigeria tops the list of African countries with 77% of its women bleaching their skin.
Now I can see that it is not good because it affects my face and some of my body parts.
Thousands of Arab Israelis and Palestinians participated in a big rally.
Flight MH17 was shot down by a Russian-made missile.
How those chips may fall is a prediction best left to the currency of time.
That's Primetime News, Africa Journal, and Your World on SABC News.
Welcome back to Health Talk. We're talking strokes. Now, we're told that a healthy lifestyle reduces your risk of a stroke. So what it is then that you need to change in your lifestyle to ensure that you avoid getting a stroke in the first place? Well, let's get that clarified by our guests. Today, we still have in our Johannesburg studio two ladies, Hayley Noval, who's an occupational therapist, or OT for short. Yep. Welcome back. And then, of course, we still have Sandra Colombink from Stroke Aid Society. And of course, in our Cape Town studio, we still have Professor Alan Breyer, a neurologist based at the Grooteskies Hospital. Now, I'll come back to you now, Prof, but I just need to, perhaps let's start with you two ladies. We're talking prevention. I mean, obviously it's important. This is a dreadful condition that no one wants to have. How do we send out a message there to say, this is what people need to do to prevent getting strokes in the first place? Let's start with you, Sandra.
How do we start? Well, you know, as the professor said, you know, diabetes, a good lifestyle, eating habits, good exercise, that sort of thing. You know, how do we prevent that? Right. Also, stress is a big factor these days. And not only these days, it's been going on for a long time, but stress is so important. And one has got to try. And, you know, if people are stressed out, they have to go to their service provider, a doctor, or someone that can help them get rid of their stress. It's not always easy, but this is a big factor.
It's actually an interesting one. Perhaps let's get a view from Prof. Now, stress. How important is stress as a trigger for a stroke?
That's a difficult one to answer because many patients who've had a stroke cite stress as what they believe to be the single most important factor that precipitated their stroke. And on a sort of physiological explanation, one of the possible explanations could be is that the stress, when a person is stressed, it does increase one's blood pressure. Right. And therefore these fluctuations in blood pressure could in fact be one of the triggers to the vessel disease or the cause of the stroke. So the increased adrenaline output, the increased corticosteroid output that occurs with stress may be a trigger via a secondary mechanism to a particular stroke. Because psychological stress can certainly affect one's blood pressure, for example.
Right. Okay. Let's get back to you then, Hayley. Other lifestyle issues.
I think I'd like to touch on where we've been with the stress. Everybody says, I'm so stressed. It's how you manage it and what you do with it. Right. And I think that's where we've got to be careful. People, they're stressed, they sleep less. They're stressed, they go out and consume more alcohol or smoke more to try and cope. We've got to look at those coping mechanisms. Going to the gym, exercising, managing your time and your lifestyle, making sure that you've got a leisure activity or a sport activity that you can switch off with. Cell phones. We are constantly on our cell phones, checking our emails, thinking we are indispensable and everybody has to get hold of us. We need time to switch off. And I think it's making your own personal lifestyle rules as a family. Let's switch off phones, let's get off devices, let's spend quality time together. And that gets rid of stress, and I think it's important.
I'm sure your young ones won't be your friends at all if you tell them not to be on the phone, isn't that so?
Well, this is the scary thing. Our youngsters are our teenagers and our high school students and our varsity students. They are put under such pressure to perform. They fall into that same bracket. And so if they've got any underlying medical conditions, they are then at risk of having a stroke.
Let's get back to something that you said, that, you know, when people are stressed, they smoke more, they drink more. First of all, they shouldn't be smoking at all.
Well, who are we to say? We can tell them that.
Obviously, we're saying smoking is one serious risk factor. But let's talk about alcohol consumption now. In practical terms, when you say somebody shouldn't be going out to binge or drink too much, what exactly do you mean?
Oh my goodness, Dr. Cello, you can't ask me that. I'm an occupational therapist. Maybe Prof. Breyer's got a little bit more of an idea. I think it's all in moderation. Anything in moderation is tolerable. We all know.
It's an interesting one because your moderation might be different from my moderation.
Yes.
Well, let's get a comment from Prof. Breyer in our Cape Town studio. What is drinking in moderation, Prof?
Drinking in moderation would be the equivalent of 1 or 2 glasses of wine, red wine, per day.
Right.
Once you start going beyond that level, then the potential benefit of the protective effect possibly of 1 or 2 glasses of wine a day is lost.
Right.
And the more you drink, the more it becomes a risk factor for stroke. So binge drinking for a number of reasons becomes a risk factor for stroke. So in moderation, 1 tot of alcohol or 1 glass of wine or 2 glasses of wine for a male may be quite okay. But beyond that, then it becomes a risk factor.
Right.
Now, just another point with regard to the exercise. One doesn't have to join a gym.
Yeah.
There are many people that can't afford to join a gym.
Absolutely.
But simply walking for a half an hour a day, 5 days of the week, that is often very good exercise as a preventative measure.
Right. I mean, we spoke earlier about obesity. Your advice around overweight and obesity.
Again, try and get to your ideal body weight. Eat sensibly. I think most people have an idea I'm not a dietitian, and one could consult the dietitian, but to eat a balanced diet. And if you do have a problem with high cholesterol levels, to eat a diet that is in accordance with that sort of problem. I think, and then also the exercise helps one, and not to eat excessively. Everything in moderation.
Sandra, we're talking prevention of strokes, but there's what we call primary prevention. In other words, preventing a stroke from happening for the first time. But it's also important to prevent a second stroke in those that would have had strokes. And I imagine those are the people that you interact quite often with, those that have had strokes, isn't that so? What sort of messages do you drive, practical messages, when you talk to people? What advice do you give them?
Well, in our support groups, we have 3 support groups. I'd like to mention that because it's very important, the type of, because stroke can happen to anybody. So we have a support group in Soweto. We have a stroke group in the South Rand, and of course in Johannesburg. But the type of thing we do is when we talk to our stroke members, we call them stroke survivors, we always tell them to strike back against stroke, to prevent these things. But we do a lot of cognitive work there, and we do a lot of activities, and we do exercise. So this is some of the things that we do. But to tell people don't ask us. It's only the people that phone in. What happens to me if I have another stroke?
I see.
How do we go about that? Well, of course, they see their medical practitioner or their neurologist or wherever they have been treated in previously.
I want you to hold that thought because I want us to continue with that after the break, okay? So what do you do when you're faced with someone that you think might be having a stroke? That and more after the break. Please stay with us.
Your destiny is not determined by the township you come from.
The one place we will find movers and shakers is in the township. It's just that they're diamonds in the rough and some of them don't even know it.
Being young with no experience in business is a challenge that Bulelani took upon himself.
I was motivated by the prayer. I was motivated by the love.
To be a novice in business was tough, but experience made him a businessman of note.
It took me 7 years to make my first million. I've got all the scars to prove that I started with nothing.
A journey well traveled.
For me, that is the one major thing. The ability to touch other people's lives. Nothing goes beyond that.
Join your host Puleng Mulebati on Bopilong every Saturday at 5:30 p.m.
You right there, mate? Son
up very well.
There are signs that you can look for to see if somebody is having a stroke, and you can look at their face to see if that's drooping, ask them to raise both their arms. If one of their arms falls or waves away, the likelihood is they've had a stroke. And if their speech is slurred or if they're talking a lot of rubbish, then that is another indication that they may be having a stroke. Another thing to check for is time, the time when the stroke happens. That's really important.
Okay, so you're faced with someone who you think has just had a stroke. How much time do you have in getting that person to a hospital or some health facility? And if it is a stroke, what is likely to happen to that person? Well, we're going to learn more about this from our special guests. We still have in our studio Hayley Novel, OT from Rehab Matters. And in our Cape Town studio, Prof. Alan Breyer, a neurologist based at the Groote Hospital. But before that, I believe we have a caller on the line. I just didn't quite get the name.
Hello.
Hello, ma'am.
Yes, speaking to Zanele.
Oh, Zanele, hi. Your question or comment, please, Zanele.
My question is, if you live in a rural area where there's no medical assistance available, and you feel that you are being attacked by a stroke, what do you do?
Very important question. Thank you very much for the question. Perhaps let's cross straight to Prof. Breyer in Cape Town. Prof, we just showed a clip of the importance of, recognizing a stroke. Please just take us through the importance of that last T, the T bit in the FAST, time to get a person to hospital. Number one, why is it important and how much time do you need? And secondly, Zanela's question around what do you do if you're in a rural area where there's, transport challenges?
Okay. Time is crucial because stroke should be treated in ideal circumstances as a medical emergency. For the simple reason it evolves around the nature of treatment in the acute phase of stroke. So the first priority is to optimize the body's physiological responses to try and get the best possible outcome. So in other words, dealing with factors like hydration, whether the patient's getting enough oxygen, whether the blood pressure is being appropriately managed at that particular time, what the blood sugar is doing, all those factors are very important to manage in the acute phase. But secondly is the option of trying to reverse the stroke with what is called clot-buster therapy. Clot-buster therapy is a drug that can be administered intravenously to try and dissolve the clot and re-establish blood flow in the blood vessel that has been occluded. Now, unfortunately, this can only be done at certain facilities that have the resources to do that because it's not without its risks, and those risks have to be explained to patients. Patients have to be given this type of therapy by doctors that are very familiar with it and know the dangers and potential benefits in order to explain this to patients. And it has to be done within a certain time frame. Such a drug has to be administered within 4.5 hours of the onset of stroke. So one needs to know exactly when the stroke started, and the patient has to get to hospital within that 4.5-hour time frame. In fact, the sooner the drug is administered, the better the chances are of getting a reversal of stroke or an improved outcome. So your results are much better if you can give the drug at 90 minutes after the stroke has started as opposed to 3 hours, and slightly less when you get to 4.5 hours. So that's the reason why time is very important. There is a new emerging therapy which I can allude to, but when you are in a rural area and you cannot get to a facility that, certainly within that time frame, it's often difficult, it's still important to be able to get medical attention as best you can that can optimize those normal physiological responses so that you don't become dehydrated because you can't swallow, you don't lower your blood oxygen and worsen the stroke because you can't breathe properly, your blood sugars aren't out of control, and your blood pressure is not adequately managed. So the sooner that you can get to medical therapy, the better.
Okay.
The
Maybe
best possible option is if you can get to a hospital with a dedicated stroke unit which has a multidisciplinary team.
That's where I want us to talk, because I think that's a bit of an issue in our country to say, how many such stroke units do you have? I mean, in the country, because it's one thing getting someone to a health facility, as soon as possible. But if you take that person to a facility where there's no expertise in handling strokes, it's kind of defeating the purpose, isn't that so?
Sure. The sad thing is that although it's been well established worldwide that your best possible options for a good outcome and for survival is if you're managed in a stroke unit. That's irrespective of whether that stroke unit offers clotbuster therapy or not, because only a minority of patients ever get to a top-rate stroke unit that offers that. But if you can get to a dedicated stroke unit, your outcome is better. In our national guidelines, it's recommended that every hospital could have a stroke unit, because it means just rearranging existing facilities and training people up in stroke care. It doesn't mean that you have to have all the bells and whistles. And in fact, a study done in one of the small peripheral Cape Town hospitals showed that mortality was halved when they introduced a stroke unit without incurring extra costs, simply training up the people that were at that existing hospital in managing stroke patients.
That's in Cape Town. Can we assume that that's the case?
Although we know that stroke unit care offers the best possible option, sadly, because of other health priorities, this hasn't been established widely, certainly in the public healthcare sector, which accounts for 80% of South Africa's patients. So Grooteskier Hospital at the time is the only public hospital, I think maybe Port Shepstone has one as well, that I'm aware of that has a comprehensive stroke unit. There are very few stroke units established in the public healthcare sector. And that's why there's currently a drive to try and get a stroke service or a stroke unit established at even the smallest hospitals. And I've seen that it can be done. Like I visited Murchison Hospital in KZN, where they were able to establish a stroke unit given existing facilities. So you don't need to spend a lot of money to do that.
Okay, all right. Let's come back to you, Hayley.
Yes.
We've spoken about how you can recognize that somebody's having a stroke, and I think we went over that a few times. And we've spoken about the importance of getting the person to get that acute treatment on time.
Yes.
Now, the person has gone through that. The person goes into rehab mode, as it were. This is where you come in.
Yep.
Take us through what you do.
Well, as an occupational therapist, we really look at function.
Right.
We want that person to get back to doing what they used to do before. They might do it in a different way, and we are there as therapists to assist them in finding different strategies and different ways of doing something. But it's looking at their life, looking at their individual story and saying, who were you before the stroke hit you?
Right.
And how can you manage to get back to those activities? And we look at everyday activities, things that we don't even think about doing. Simple things like being able to brush your teeth with one hand, being able to dress yourself, getting back to taking care of yourself, your children, cooking a meal. And then we've got to look at the bigger picture and saying, how do you look after your home, your family, getting back to work? So it's an integral role.
It's important that you mention home, but I mean, obviously there's a time when the person is in hospital, as it were.
Absolutely.
And so you start your rehab when the person is still in hospital?
As soon as possible.
And how long do they normally stay in hospital for?
It really varies because we are bound by funders. We are bound by how much medical cover patients have.
Right.
We like to see them often within the first couple of days as an interdisciplinary team.
Right.
We start getting involved.
Right.
And we'd like them to be there for at least 8 to 12 weeks. If we could have them for longer than that, that would be great. But we also recognize that the acute phase is important, and then we start looking at how do they manage after that.
Right.
The international research shows us that the studies have shown that patients should have at least 45 minutes to an hour's worth of treatment by each discipline, OT, physio, speech, every day for 5 days a week to have the maximum output and the best prognosis.
And what about, now we hear that the so-called step-down facilities, in other words, people get discharged from a main hospital and they go to continue rehab at a step-down facility.
Yes.
Just tell us the difference between the two, please.
I think we need to be careful. A step-down facility, there is often therapy that is offered, but it's limited because the funding is limited.
Right.
And so your rehab facility, you're going to have the optimal amount of rehab. Step-down facility, there's going to be nursing care. There will be training of the caregivers, education of the family, but it's limited. And sometimes patients are medically not well enough for the intensity of a rehab program. And so they may go to a step-down facility and then be able to, as they recover, be able to go to a rehab facility where they can participate better.
Yeah. But then again, it's a question of access, isn't it? So
absolutely.
Not all stroke patients, let's call them that, will have access to rehab centers.
Exactly.
Just an idea, quick idea, costs of going through rehab.
Oh, Dr. Selo, you're catching me off guard here.
But it's quite expensive.
It is expensive.
Yeah.
I think what we need to realize is that the health professionals, particularly in private healthcare, are willing to accommodate and to speak to people. We understand the importance. Yeah. If they can only access a government facility, go there. Start the process, but then start looking.
I suppose the idea we're mentioning this, just how expensive it is to say that let's focus on rather preventing a stroke from happening in the first place.
Absolutely.
Well, Hayley Novel, thank you very much for your time.
Thank you, Dr. Selo.
And to you as well, Prof. Brianna in our studio in Cape Town, thank you so much for your contribution.
Thank you indeed. It was a pleasure to be on your program.
All right. Well, folks, it's on that note that we come to the end of our show today. Join us again next week on SABC News. And remember, please share your views and comments with us via Facebook page, SABC Health Talk, and follow us on Twitter, SABC Health Talk. You can watch repeat of this show today at 2 p.m. and then again Tuesday at 5 a.m. in the morning, or simply go to the YouTube to get all our previous shows. I'm Dr. Selomit Daung. Thank you for watching, and please do take care.
Your destiny is not determined by the township you come from.
The one place we will find movers and shakers is in the township. It's just that they're diamonds in the rough and some of them don't even know it.
Being young with no experience in business is a challenge that Bulelani took upon himself.
I was motivated by the prayer. I was motivated by the love.
To be a novice in business was tough, but experience made him a businessman of note.
It took me 7 years to make my first million. I've got all the scars to prove that I started with nothing.
A journey well traveled.
For me, that is the one major thing. The ability to touch other people's lives. Nothing goes beyond that.
Join your host Puleng Mulebati on Bophelong every Saturday at 5:30 p.m.